Good morning, and thank you all for attending. Today, I'm joined by Andrea McLellan, Director of COVID-19 Immunization Strategy, who will speak about the COVID-19 vaccine rollout, and Shannon Mantha, Executive Director, Clinical Services and Chief Nursing Officer, to provide an update on the local COVID-19 situation. In an effort to stop the spread of COVID-19, the province announced a provincial shutdown to help slow the spread of the virus across Ontario and prevent our healthcare system from being overwhelmed. Yesterday, the province declared a third provincial emergency under Section 7.0.1 of the Emergency Management and Civil Protection Act and issued a province-wide stay-at-home order. I know this is difficult for all of us, for our financial well-being, our social health, and for our mental health. Small businesses have been particularly impacted by the uncertainty and ever-changing restrictions from week to week. However, these measures are urgently needed if we are to slow the spread of the variants, save lives, and return to a more normal life in the shortest amount of time possible. Locally, we are not seeing the same increases as the rest of the province has. This is thanks to the hard work and sacrifices you've all made. As we have said before, we're not an island. Province-wide restrictions are necessary at this time. When one health unit has significantly lower restrictions than another does, it encourages people to travel, increasing the risk of spreading the virus. When our health unit regions align, we have consistency, and this reduces travel from one district to another, which helps to keep us all safe. The province-wide stay-at-home order requires everyone to remain at home except for essential purposes, such as going to the grocery store or pharmacy, accessing healthcare services, including being vaccinated, for outdoor exercise, or for work that cannot be done remotely. With that, I'd like to now hand it over to Ms. Mantha to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. So we've had 7 confirmed cases this week, bringing our total case count to 307, with 3 cases this week in the Nipissing district and 4 in the district of Parry Sound. As of this morning, we have 18 active cases, with 5 of these cases having screened positive for a variant of concern. 1 of the 18 cases is currently in the hospital. Updated case numbers, as always, will be reflected on our website at 3 p.m. today. Additionally, late yesterday afternoon, we received confirmation that a member of the Silver Birches public school community tested positive for COVID-19. The health unit is working closely with Near North District School Board, and I'm pleased to say that all high-risk contacts have been notified, and they're all aware they are required to self-isolate for the next 14 days. We have not declared an outbreak at the school, as there is only 1 confirmed case. Later this morning, we'll be issuing a public service announcement regarding this case at Silver Birches Public School. And in terms of schools, earlier this week, both Peel Public Health and Toronto Public Health issued Section 22 orders under the Ontario Health Protection and Promotion Act to close schools for in-person learning and move to strictly virtual learning. Both of these health unit districts had seen significant increases in case counts, as well as the rapid spread of variants within the community. We here at the health unit know how important it is for students to continue in-person learning, and locally, we are not seeing transmission of COVID-19 within our schools. Many students in the district, being in the north, we face barriers to remote learning, and in some cases, barriers that go beyond just access to the internet and technology. We know that being at school with peers and educators has a positive impact on our children and youth's social, emotional, and physical well-being. So, considering all of these factors, the health unit's very supportive of continuing in-person learning for students in the district during the provincial shutdown. However, should we see transmission of COVID-19 within our schools, we will work closely with the local school boards to take the necessary steps to protect the health of the school community. So with that, I'll pass it back to Dr. Chirico.
Thank you, Ms. Mantha. Ms. McLellan, can you please provide an update on our vaccine rollout this week?
Thanks, Dr. Chirico. Good morning, everyone. As of 3 p.m. yesterday, we have provided 23,206 vaccinations in our district. That equates to 20.8% of those individuals 18 years of age and older who are residents of our district having received at least one dose of the vaccine. At the ministry's direction, clinics across the province were opened up to individuals 70 years of age and older last week, and we have had a great response to this. All of our vaccine clinics this past weekend were fully booked. This week, we continue to move forward with vaccine rollout as individuals born in or before 1961 are now eligible to book an appointment for their vaccine. As more and more groups are added to the rollout, we continue to advocate with the province for greater access to COVID vaccines. Our clinics are filling up very quickly, and we continue to add more of them as we are provided with vaccine allocation information. The health unit's call center is open to anyone who requires assistance booking an appointment. We are experiencing high call volumes and encourage those who are able to do so to book online. All of our clinics across the district have been an overwhelming success, thanks to the hard work and collaborative efforts of many people, including municipalities, our community partners, the staff and volunteers who are working at our clinics. Their support and commitment is key to our success. Our vaccine rollout is truly a community effort. We've had an amazing response to our request for volunteers, and at this time we do not require any additional volunteers. But we need to remember this is a long process, and we will require more volunteers as we move forward. So please watch our volunteer page on our website for updates. Last week, the province announced that pharmacies will be helping with the COVID-19 vaccine rollout by offering the AstraZeneca vaccine to individuals 55 years of age and older. In our district, the ministry has announced 3 pharmacies that will offer the vaccine. There are 2 pharmacies in North Bay and 1 in Parry Sound. Appointments for these locations must be booked with the pharmacy, as their vaccine supply is allocated directly to the pharmacy from the province. There are plans for the ministry to increase the number of pharmacies who have the AstraZeneca vaccine available, and planning is also underway by the province to include primary health care providers in the sites that will offer access to the vaccine, and we look forward to sharing updates once the plan is finalized. AstraZeneca has been approved for use for individuals 55 years of age and older and is administered in accordance with recommendations from the Ministry of Health, the National Advisory Committee on Immunization, and Health Canada. And with that, I'll hand it back over to you, Dr. Chirico.
Thank you, Ms. McLellan. And that's it for our prepared remarks. And so now we'd like to begin answering your questions. So if you have questions, please type them into the Q&A at the top of your screen. Our moderator will read them aloud, and we'll try to cover off as many as we can. And when possible, please ensure that your name is attached to the question. So Alex, if you could please read out the first question.
Perfect. So our first question is for Andrea. It comes from Clark from YourTV/Cogeco. A number of people have praised the local vaccination clinics locally for how smooth and well run the clinics have been. When will local teachers be able to get their vaccinations?
Teachers fall under the essential workers category of phase 2. And so we will be planning for that rollout in the near future. There was an announcement made that special education teachers in the hotspots initially will have access to vaccination, and it'll roll out from there.
Thank you. The next question is also for you, Andrea. It comes from Greg from Moose FM. Has there been any traction in getting more vaccinations or vaccines in our region? How many more shots per day could you realistically administer if you had more supply?
That's a great question. At this point in time, we have not been allocated any additional vaccine above what we were already aware we would be receiving. I know that the ministry is allocating vaccine to the hotspots within the province and those neighborhoods where there are significantly higher numbers of COVID cases. What number could we do realistically? I believe if we had the vaccine supply, we could do upwards of 3,000 to 5,000 doses a day.
Thank you. This question is for Dr. Chirico from Chris from Bay Today. From how you dealt with ice rinks and snowmobile trails, should residents be concerned with a ban of outdoor spring activities such as closing parks?
I think what's important to know is that what we want people to do is to use good judgment. And so yeah, it's very important for people's mental well-being, physical well-being to get out and exercise. But we want people to do it in a safe manner. And so where you go is important. So you certainly want to avoid any type of gathering. You want to maintain the 2-meter physical distance, wear masks when appropriate. So we need people to use good judgment. And we're waiting to get clarification with regards to the legislation and the regulations that will be accompanying the additional orders that have been mentioned in the last day. So once we get that, we'll have further details on what exactly will be open and won't be open.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Clark from CTV/TV, or Cogeco/Your TV. Our health unit, the opioid-related deaths from January to December was 34.7 deaths per 100,000 people, the 5th highest in the province. What correlation is there between the pandemic and opioid use? Are there statistics to support this?
What we do know is that COVID-19 has taken a significant toll on many of the most vulnerable populations, including those with addictions. And we've seen that with drug overdoses, and we've seen it certainly with an increased number of deaths. We're working with community partners to address this. It is a serious issue. We have plans in place to look at the potential for an overdose site, a safe site to prevent overdoses, and we are working with community partners so that we can address this situation.
Thank you. This next question comes from Sarah from the North Star and will be directed towards Andrea. There are no clinics listed in the West Parry Sound area after today. Can you give an update on when the next clinic will be?
Yes, I can. When we identify clinics, we have to put them through to the provincial booking system to be uploaded into the system. And that can take anywhere from 3 to 5 days. We have clinics planned for every week, every Tuesday, beginning next week in the Parry Sound area for the next 6 weeks, based on the anticipated allocation of vaccine. In the event we receive more vaccine, then we will increase the number of clinics and the hours that we have available. But there should be six clinics, 1 a week, going up any day.
Thank you. This next question is for Dr. Chirico from Sarah from the North Star. When the province ordered the stay-at-home order for all health units, did you give a sigh of relief? You've mentioned many times that we are not an island and that different restrictions in different areas encourages travel.
Yeah, thank you for that question, Sarah. I think it's an important point that, did I breathe a sigh of relief? I was very supportive of the actions that the government is taking for the very reasons that you've mentioned, that we have to all do this together, and we have to do whatever it takes to slow the spread. And we know that it's been effective when the whole province acts together and when it discourages travel. So yes, I'm very glad that this has occurred, and that, you know, we just have to look back. I think there's a lot of hope and a lot of control that we have over this, because you look at what we did in the first wave, where we were able to slow the curve so that lots of people did not get sick all at the same time, which could have overwhelmed the the healthcare system. So we know it works, and that's why we're really appealing to each individual person to take responsibility to do what you can to slow the spread, follow the public health restrictions that are in place. And I know that it's difficult. We've all been dealing with this far too long, but we've got there's sunshine at the end of the tunnel, and it's the summer. And we hope that by people doing this, we will all be able to enjoy a really great summer, but we got to do the work now.
Thank you. Our next question is for Andrea. It comes from Alana from CTV News. Is there a timeline on when people with physical disabilities and/or underlying chronic medical conditions will be able to receive their vaccine?
Thank you for that question. We're in the process of working with the LHIN and community healthcare providers to identify clients who meet that criteria and plan clinics for them. And as far as those with chronic medical conditions, that planning is still happening at the provincial level, and we will follow the direction from the province on that.
Thank you. Our next question is also for Andrea. It comes from Clark from Your TV/Cogeco. Last but not least, when will the North Bay Jail staff/officers be vaccinated? Again,
they would be part of the phase 2 vaccination, and I would say that'll occur over the next in the next couple of weeks.
Thank you. Our next question.
I just wanted to add to that, if I could. I know that you've heard this before, as far as saying that we're expecting to get more vaccines, and certainly that message has come before, and I think that it is becoming closer and closer to actually becoming a reality. I know that the provincial government is doing their very best to get as much vaccine as they can through the federal system, and that as soon as it's available, they get it out to public health units in areas that certainly are in crisis and need it the most. So there is, I believe, a good reason to expect that within the next few weeks that we will be getting more vaccine. And when we do get that, we'll be rolling it out as quickly as we get it.
Thank you. The next question is directed towards Shannon. It comes from Sarah from the North Star. There are a number of cases linked to an outbreak. What/where is the site of this outbreak?
Yeah, thanks for this question. There's a couple of reasons on our website when we report this way. Sometimes it might be a local outbreak, and other times it might be cases that are linked to an outbreak out of our district. So at present, right now, we do have an outbreak that was declared by Nipissing First Nation, which is focused on the community of Duchesne. This is being managed by Nipissing First Nations Health Services, community health nurses.
Could I also add to that, Alex, if I may? I think it's important too to recognize that in addition to outbreaks as a mode of transmission in the community, most of the cases that we're seeing are because of cases and contacts and people that know each other. So potential in households, potential of people that may have been tested positive. So I think it's really important that it underlines the fact that people need to adhere to the public health measures. And by doing that, you can really interrupt the transmission and reduce the spread by our own simple actions.
I'll add to that too, Alex. Sorry, just a number of our cases have a history of traveling out of district to areas where there's wide community spread of COVID. And so just further to Dr. Chirico's point, just considering that as you go about your daily lives and the public health measures that are in place, when you visit areas where there's lots of community transmission, there is an increased risk.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. Have there been any no-shows for vaccine appointments?
I don't believe there have been. I'm not 100% certain on that. I can certainly check the system to confirm that. If there have been, it's been very minimal, but we'll get back to you with that information, Jennifer.
I'd like to also add too that there is a contingency plan in place that if we do have partially unused vial at the end of the day with doses, we have to use it up. And so we do have a contingency plan to vaccinate at the end of the day. And we haven't really had a problem using it up. We haven't wasted really any doses. When you consider we've given over 23,000 doses and there hasn't been wastage. So everything gets into arms.
That's good. This is also for Andrea. It comes again from Jennifer from the Nugget. What is the recommended time between a first and second dose of AstraZeneca? And how many more AstraZeneca vaccines does the health unit expect to receive in the upcoming weeks?
The recommended spacing for AstraZeneca would be the same as the spacing for Pfizer and Moderna, so that's 16 weeks between the first and second dose. And at this point in time, I don't have a sense of the allocation that we will be receiving for AstraZeneca. AstraZeneca is distributed to pharmacies directly from the ministry. It doesn't come through us, so we don't know what they get or when they get it.
Thank you. Our next question is for Dr. Chirico. It comes from Greg from the Moose FM. The North Bay Council passed a motion Tuesday advocating for more vaccine supply, specifically requesting for unused vaccines from Southern Ontario to be sent up here. Is this something that would be possible? Would it be something the health unit would advocate for?
Certainly, we would advocate for more vaccine. We were in a position where when vaccine first became available, it went to hotspots, it went to areas with high need, and we were about 6 weeks behind. So we would and have been advocating. I want to thank municipalities for their efforts to do that, and to advocate on our behalf to get more vaccines so that we can catch up. Because every time there is a change to the groups that are being vaccinated in Southern Ontario, it also applies to us. And we don't have the vaccine to catch up to them. So if they open it up to 60 plus in Southern Ontario, it's automatically opened up to 60 plus up here because we're on the provincial booking system and there isn't any real ability for us to customize that booking system at all. So anybody can book. So we're hoping that this will have an impact and that, yes, we would like to get more vaccines, especially if it is unused down there.
Thank you. Our next question is for Andrea, comes from Sarah from the North Star. How many vaccine doses does the health unit expect to receive weekly for the next few weeks?
Unfortunately, we aren't allowed to share that information. That's confidential information, but we are booking clinics to utilize the vaccine that we are receiving.
Thank you. Our next question is for Dr. Chirico from Jennifer from the Nugget. Do you support the opening of golf courses?
Well, playing golf, certainly I know that last year when we were under a stay-at-home order, that golf courses were allowed to open. And similarly, and we're still trying to get clarifications if they are open now. We don't have the regulation in the e-laws to refer to yet, hasn't been updated. But if they are open, then they have to adhere to strict rules in order to ensure that there's physical distancing, that there is there's no gathering, and that the clubhouses are not open for dining and gathering. And if we find that we are getting complaints of golf courses not adhering to the rules, and that it poses a significant risk, we will close them down.
Thank you. Our next question is for Andrea. It was submitted anonymously. It reads, I've heard people are trying to book appointments for vaccine clinics, but they are told to go to St. Charles or Temagami as there are no appointments locally. Is this true?
I can't speak to that. I don't know what people are being told. Certainly don't believe we're directing people elsewhere. We are filling our clinics as they are there, and we're encouraging people to continue to watch for new clinics to go up and to book into our clinics then.
Thank you. Andrea, this question is also for you from Jennifer from the Nugget. And are there any discussions of a mobile vaccine clinic?
We're using a mobile vaccine strategy for our homebound individuals who can't come out to a clinic. That's currently underway in working in partnership with our community paramedics. So that is something that is currently underway, and we will, if we have other populations that may be useful to use for, we would certainly consider that.
Thank you. Our next question is also for you, Andrea. It comes from Sarah from the North Star. Will paramedics start to immunize seniors living in community living apartment buildings?
Our paramedics are focusing on providing immunizations to homebound home care clients at this point in time, and we will be engaging in conversations with them for additional support on an ongoing basis as the need is identified.
Thank you. Andrea, this question is for you from Jennifer from the Nugget. Is there any progress on developing a list of last-minute vaccine appointments?
I'm assuming you're meaning for vaccine that may potentially be left at the end of a day. We do have a strategy in place for that. We're not asking people to contact us to get put on a list. We are working with community partners to identify high-risk individuals who may benefit from being put on that list, but we would only reach out in the event that there is vaccine left at the end of a clinic.
Thank you. And our next question is also for you, Andrea. It comes from Chris from Bay Today. What is the status of primary care doctors' offices getting vaccines to complement pharmacies and area vaccine centers?
That planning is currently underway. We have reached out to a number of our primary care providers to determine their level of interest in participating in receiving vaccine to administer within their practices. And so as vaccine becomes available, we'll be rolling it out to some of those practices based on the amount of vaccine that we receive. Thank
you. Our next question is for Shannon. It comes from Mo from Moose FM. Ontario just announced a new range of protections for schools remaining open. Those include on-site confirmation of self-screening and asymptomatic testing expansions. What added measures will our district schools be seeing?
Sure, thanks for that. So in terms of added measures, I think the asymptomatic testing has already begun in our district. And so we may see an increase in that or an expansion of the amount of schools or school boards involved in that testing. Additionally, in terms of the self-assessment, schools are doing and parents and children and youth are doing a really great job already of doing the self-screening every day prior to reporting to school. And so really what this difference means is it's just going to be an added piece of collection of information on the school's part. And throughout the pandemic, we've worked closely with all our local schools and school boards, and we will assist them in doing that as much as possible to ensure that we can keep the school community as safe as possible.
Thank you. Our next question is also from Mo from Moose FM, and it is directed towards Andrea. In addition, beginning next week, the province said education workers who provide direct support to students with special education needs across the province and all education workers in select hotspot areas will be eligible to register for vaccinations. Is our district on that same timeline?
We will be rolling out to special education teachers as directed by the ministry. We will be working with our local school boards to determine eligible individuals and a process for them to book their appointments.
I'd like to add to that in that our clinics that are currently booked with individuals, and again, because of the delay and because that we haven't had enough vaccine to catch up, we will not be displacing any of the currently booked individuals in our clinics that are full, and that we certainly will be vaccinating them, the individuals that you mentioned, when we have vaccine available and clinic spots are accessible to them.
Thank you. Our next question comes from Jennifer from the Nugget and is also for Andrea. Is the timeline for every adult to receive their first dose still by June?
Provided we have the vaccine supply to do it, yes.
And then a follow-up question from Jennifer. Will those 16 and 17 years of age be able to be vaccinated?
Perhaps I could address that. It really is, we follow the recommendations certainly through Health Canada authorization, as well as recommendations through the Ministry and National Advisory Committee on Immunizations. And it will depend on what vaccine is available and further studies that occur, which are underway, as we all know, in regards to the safety and effectiveness of those vaccines in those age groups. And there's lots of real promising studies coming out, and we're awaiting the authorization, and we'll certainly update you as to who will be eligible once they make that determination.
Thank you. We have no other submitted questions. So with that, we will conclude today's press conference. We will be back next week at 10 a.m. Thursday, and this press conference will be available on our website later this afternoon. Thank you.